My name is Sergiusz Jozwiak. I am pediatric neurologist working with tuberous sclerosis in Warsaw, Poland. I was working for many years in the Children's Memorial Health Institute, and I was the head of the ISAW project. Now, since 5 years, I am working in the Warsaw University in the Department of Pediatric Neurology at the university. Epilepsy is affecting about up to 90% of patients with tuberous sclerosis. Up to 70% of them develop epilepsy in the first 2 years of life. When we should start to treat this epilepsy? Usually we do when, of course, when the child has epilepsy, but much better results we may obtain when we treat abnormal paroxysmal activity in young infants just at the beginning of epileptogenesis in these patients. In fact, during the recent years, we have more and more prenatal diagnosis of tuberous sclerosis. We have more and more patients with this prenatal diagnosis. And it is time to discuss with young parents about possible early intervention in this group of patients after birth. We very often even have a first call with these pregnant women discussing about this early intervention and preparing them for this EEG surveillance we do in the first months of life of these children. According to European recommendations, currently we do EEG every 4 weeks in the first 6 months of life, every 6 weeks in the second half of life, and every 8 weeks in the second year of life. And we are looking for the beginning of epilepsy. In 70% of patients, we can find the beginning of epilepsy. We can find abnormal paroxysmal activity on EEG. And at this moment, we start the treatment. Usually epilepsy starts with partial seizures, not infantile spasms. So very often we are asked how to treat tuberous sclerosis, how to treat epilepsy, how to treat infantile spasms. Infantile spasm is a late stage of epilepsy development. Usually those children, those infants have epilepsy beginning with partial seizures, and we should start to treat them. Last month, we published in Pediatric Neurology a survey we did in tuberous sclerosis centers across the world, and we obtained answers from 60 centers how they treat epilepsy in tuberous sclerosis patients. And 70% of patients, of sites are doing EEG surveillance. 50% of the sites are treating preventively epilepsy in tuberous sclerosis. The importance of early intervention, it is really, really important. In 2011, we published a short report, a very small group of 14 patients who were treated preventively. And we got much better results in respect to the drug-resistant epilepsy and also developmental disability. Now we have much more results. Just last month was accepted the main paper, clinical paper from ISAW trial, which will be published in Annals of Neurology. And in this large study, 100 patients from Europe and from Australia, we found that with this preventive treatment, we are able to postpone the development of epilepsy, and we are able to prevent the epilepsy development in many of those patients. And what was very interesting, that even in the conventional group, which was not treated preventively, but had EEG surveillance, in both of these groups, we had no patients with IQ lower than 50, which is a very big difference comparing to those children who are treating after having infantile spasms. What is the best treatment for infantile spasm or for epilepsy? As I mentioned, epilepsy starts with partial seizures, not with infantile spasm. So when we have a child with infantile spasm, if we have a child with hypsarrhythmia, it is not good prognostic factor. We should try to treat those patients as early as possible. For this preventive treatment and as well for the partial seizures, we are using as a first drug vigabatrin. Vigabatrin with dosage of 100 to 150 per kilo. Sometimes, particularly if we start this treatment late, we may be unsuccessful. In these cases, we are trying sometimes to use oral valproic acid, which seems to have a very good combination with Savril, or ACTH. ACTH is a treatment which is usually recognized treatment for hypsarrhythmia in patients with early childhood epilepsy. Parents may help doctors to treat patients. Particularly in this group of patients who are in EEG surveillance, it is very important to also recognize first seizures, partial seizures, which may last very shortly, just a few seconds. It is just rotation of the eyes. It is abnormal breathing in the child, lasting for several seconds, 10 seconds, 15 seconds, and child is becoming aware again. So it's all these abnormal movements should be registered by parents very often on a mobile phone, and can be sent and seen by doctors who may recognize first partial seizures in this patient. Sometimes there is consciousness, awareness even still kept by the child. So it is very important that it's not easy for parents to recognize the first seizures. So it is very important just to record any abnormal movements of these young infants and to demonstrate them, to show them to doctors. Another thing which is very important, how long we should preventively treat those patients. We usually take particular attention to patients during the first 24 months of life. If there are no seizures, no epilepsy during this time, we usually try to taper off this preventive treatment if there was no epileptic seizure in the meantime. So in those patients who are on treatment, we also in those patients who are on EEG surveillance, if we are doing this EEG surveillance and during 24 months we don't see any changes, we may stop this EEG surveillance after 24 months. And even why 24 months? Because epilepsy which starts later usually is not so harmful for neurocognition, for development, neurocognitive development of these children. So it is why 24 months. How long should we treat? Just if there are seizures, we are treating as epilepsy. So it depends on the doctors. They should establish a proper time for the treatment of these children. I think they are the most important points. Thank you very much.